So I wanted to formally introduce you. Yeah? What's the matter? I wanted to formally introduce you to Anne-Marie. We just call her Annie, but most of you guys probably know that. So I just thought it would be a good idea to maybe just kind of introduce you to her and share a little bit about her birth story. Do you not want the milkies? You don't want the milkies? I'm going to do my best not to keep the birth story particularly traumatic. It can get pretty bad, but we're not going to go that way. Also, yeah, we still have things that we are unpacking and need to be moved out of the room. And there's Penelope. So just excuse the fact that we don't have a real aesthetic backdrop at the moment. I don't think you want that. You don't want that? No. We also have a little bit of a fuss pot. Yeah, she's been refusing her naps recently, so she's on the cranky side sometimes, but she's great. She's actually a really good baby. She was born on November 22nd of 2022, and we had an induction planned. I originally did not want an induction. I had a lot of anxiety about Pitocin just because I know that Pitocin can sometimes increase risk of postpartum depression, and because I've suffered with, clinical depression, I've been a little nervous about increasing any kind of risks for that. I actually stayed on all of my psychiatric medication and stuff during the pregnancy, and that was a decision that my psychiatrist and my OB and I were all on board with. And it was honestly probably one of the best decisions that I made regarding my pregnancy. My mental health was so good. I tell people that I miss being pregnant all the time. And I mean, not really like the third trimester because like my body hurts so much. But the hormones just make you feel warm and fuzzy, and it's amazing. So I always tell people, like, I'm so excited for you to be pregnant because being pregnant feels so good. Of course, that's not the case for everyone. That was just what happened with me and Annie. But as I said, I didn't really originally want an induction, but it got to the point where I was on bed rest because I physically couldn't walk anymore because of pelvic pain and knee pain and ankle pain. It was so bad. And I'm someone who is very accustomed to pain, as, considering the fact that I have lupus, like joint pain is pretty normal for me. But this was horrible. I genuinely couldn't walk. I couldn't walk Rigby. I had to have like my sisters-in-law come over and walk the dog during the day when Corey was at work. The last week before the pregnancy, Corey had to start his paternity leave early just because I couldn't do anything around the house. And so in my last OB appointment, I talked to my provider and I was like, I don't think this is going well. I think maybe we should consider an induction. And so he agreed, and he said that the pain, like the pelvic and hip pain, was only going to get worse. And it was probably because of the position she was in. We now realize that she was face up, which puts a lot of pressure on your back. But anyways, that comes back into play a little later on. So if you also had a sunny side up baby, let me know in the comments, are you okay? Because wow. So we go in for my induction on November 21st, or was it the 20th? It was a Monday. It was Monday morning, and we get there bright and early at like 6:30 a.m. And as it turns out, they don't have any rooms available for me because they've had like a bunch of women come in actively in labor. And so I'm waiting for literally 2 or 3 hours before they're like, just go get breakfast and we'll call you when we have a room. So Corey goes home to walk the dog, and my dad is already there. He was so great. My dad was there throughout, like, the entire process, except for the actual delivery. So my dad and I go, and we get breakfast together, and it was really delightful. I don't know. I've lived in a different state from my parents for a long time because of graduate school and stuff. And so it had just been so long since I actually got to sit down to a breakfast with my dad. And that was just really special. And I think back on that really fondly. And so I call them for an update. And lo and behold, they have a room for me finally. And so it's 11 o'clock at this point. So quite a ways later than my, like, 6 a.m. Arrival. And we get things moving. We use, like... They give you, like, a little pill suppository to start inducing labor. I was about 1 to 2 centimeters dilated already. So, like, we thought, you know, we were starting off on a good foot with that. And then we end up using, what is it? It's like this balloon, like this Foley balloon thing to start, like, putting pressure on your cervix to increase dilation. So we're just sort of, like, stuck in the throes of trying to get labor started for a long time. And gosh, I think that was going on until, like, 6 p.m. or something like that. And I was just stuck at, like, 3 or 4 centimeters. I was just stuck there. And so they were, like, increasing Pitocin and stuff. And finally, I start feeling contractions. The entire time that I'm there, I'm contracting every 2 minutes. And I don't feel it at all. She just wants the bottle in her mouth. She doesn't actually want to drink it. But she knows if it's a pacifier, and that is not what she wants. Yeah? That's not what you want? Oh, okay. Yeah, she finds this really soothing. It's probably going to bite me in the butt later on that I let her do this. But you know what? When you have a cranky newborn, you take what you get. So finally, around, like, 6 or 7 p.m., I start feeling contractions. And I'm not feeling them in the normal way that you would feel contractions. I'm having back labor. And oh my gosh, it is as awful as everyone tells you it is. Back labor is terrible. And I didn't know why I wasn't feeling it, like, in my uterus. I was just feeling it in my lower back. And as someone who was already having back pain, this was an absolute nightmare. It was so bad. And so I kind of, like, ride it out for a couple hours, but then I finally give in, and I'm like, I didn't want the epidural this early, but I need the epidural because I am in so much pain. Yeah. Oh, it was really painful. Yeah, it was. And so I get the epidural. It takes like 10 minutes. I delivered at a teaching hospital, which is something that I really wanted. So there were, like, 2 things that I really wanted about the hospital I delivered at. The first was that it was a teaching hospital, because I am the type of person who's really comfortable letting students help out. And so I, let them practice cervical checks and stuff like that, because I'm not squeamish, and as someone who has experienced chronic pain, like, a cervical check is nothing to me. And so I just want to help out any way I can. And so they had a student help out with the epidural, and it wasn't an issue. Like, they had a little bit of trouble getting it in, but they give you, like, a numbing shot first, and that probably felt worse than the actual epidural itself. The hardest part about the epidural was just sitting still in this hunched over position for, like, the 10 minutes that they were trying to get it in. And like Corey was great. Because it's like kind of a procedure, they only let like your partner in, and I had like all three of my sisters-in-law and my dad in there, and I think my mom was there at one point too. We had so many people. And so they kick everyone out, and it's just Corey and me, and Corey did great. I know sometimes you hear about partners like passing out during epidural placements and stuff, but like they didn't hit me in any weird spots. We didn't have a cervical fluid leak or whatever that's called, cranial fluid, I don't know. We didn't have any kind of weird fluid leaks. Like, it was a great epidural. They tested it, they flushed it, it went perfectly. So I get my epidural and I stop feeling the back labor, which is amazing, absolutely amazing. And so I am able to eat a little bit. Like, they don't really want me eating, because, like, what if you have to have surgery? What if you have to have an emergency C-section? But, I mean, I had been in labor all day, and it wasn't even active labor. And so it was like, well, I think we're far enough away at this point that we should probably get some fluids in me. So I got plain rice and chicken broth, and I put the rice in the broth and tried to make soup and ate some applesauce, and had a steady diet of these weird sugar-free popsicles that they had in stock. That was like the one thing they would let me eat. I felt so dehydrated. I was just chugging water the entire time. My lips were crazy chapped. It was super weird. I don't know if that is a normal pregnancy response or if this is like a signifier of something that we find out a little bit later. But oh my gosh, I felt so dehydrated. I went through so many bottles of water. It was wild. So I get a little food in and we go to sleep. My family and Corey's family leave for the night, and I get maybe 3 or 4 hours of sleep because, like, there's people coming in and out, checking you, doing cervical checks every 4 to 6 hours, and, you know, and so the epidural did slow my contractions down a little bit, which was a bit of a disappointment, but it's okay. And so by the time, like, things get rolling again in the morning, I'm still at 4 centimeters dilated. I hadn't changed all night. It was such a disappointment. We have to kind of amp up the Pitocin a little bit just to get things actually moving in the right direction. And so a little later in the morning, maybe around 10 o'clock, I start feeling the contractions again. And we know that my epidural is still working. I'm not feeling contractions in my uterus, and that's a shame. But I start feeling it, like, in my rectum, which is not something I was prepared to feel. Like, no one tells you that you can feel labor there, right? Like, that's not something you expect. So it turns out that you can feel your labor contractions there based on the placement of your baby's head. And that's kind of what pressure starts to feel like when you start advancing in labor. So it takes a little while to get us to 5 centimeters, but I'm like, these contractions are really, really painful, and the epidural's not working. I mean, it's working, but it's not fixing anything in that spot. I don't think the epidural is supposed to affect that spot because, like, you kind of need to feel like you're pushing, like when you're pushing. So that was unfortunate. But by the time it hits like 4 or 5 p.m., I am in so much pain. It is horrible. I, like, kick everyone out of the room and just kind of, like, start crying to Corey. And I'm like, this is so awful. I can't even, I just can't believe it feels this bad. Like, it literally just makes you feel like you have to have a huge bowel movement, and it's so painful. I don't know any other better way to describe it, and maybe that's TMI, but I'm telling you guys my birth story, so the whole thing is probably a little TMI. But I also think it's important to talk about some of the stuff that maybe no one tells you that you can experience during labor. So let me be that person to tell you that can happen. So we're watching the Great British Baking Show, and because like they had the holiday episode out, and I had been saving it for a moment I really needed it in labor. And let me tell you, we hit that moment. So it's really quiet, and Corey's the only one in there with me. My mom comes for a little while, but then she kind of starts getting anxious because she does that, and she had to leave. And labor didn't look like it was progressing quickly. Like, I had finally gotten to like 5 centimeters, but considering how long it took me to get to 5 centimeters, we weren't expecting, things to progress as quickly as they could have. So the doctors come in, and I'm like, listen, I'm in so much pain. I can't bear this. I don't know what's going on. This feels really weird. And they're like, it's just pressure. Like, it just means your body is getting ready to start pushing. That's good. That's good. Like, it means your labor is probably progressing. So they do a cervical check. I'm around like 6 to 7 centimeters dilated. So we're making clear progress. And they decide to send anesthesia in for a consult. So they gave me another like bolus of epidural or something. I don't even know what it was. I was in so much pain. I was just like, give me something. I can't deal with this anymore. So they give me something through the epidural, and it helps a little bit. I'm able to eat a popsicle. I order a little bit of food. I try and just do the broth and rice thing again, but I was still in like enough pain that I couldn't even functionally eat. Like, you hit that point in labor where your body is just like, it's past eating. Like, you want to be fueled and powerful and prepared for labor and the delivery process, but food sounds terrible. You just can't eat it. So I try and eat a popsicle. I can't even finish the popsicle. I'm like, here, Corey, eat my popsicle for me. I don't even remember if he ate it, or he probably just threw it away. And so at that point, labor starts really amping up. I get to 8 centimeters dilated, and this is maybe like 6:30, 6 o'clock, probably 6 o'clock. It's 6 o'clock the next day. So I had been in labor for 2 days at this point. And they come in and they start like kind of fiddling with the monitors and stuff, and like make me change positions. Ugh, they made me use the peanut ball, and I hated the peanut ball. Like, it works, but I hated it. I was so uncomfortable. It was awful. They try and like, switch things up to, catch her on the fetal monitor again. And not 30 minutes later, they come back. At this point, I'm 9 centimeters dilated, so things are moving really fast. Probably around 6:30, they come back, and they're like, all right, we're going to check you, and I'm complete. I'm 10 centimeters dilated. It's go time. And they're like, all right, it's time to push. Also, we're noticing some decels for your baby, which I think is just like kind of erratic, or changes in heart rate, or like drops in heart rate. So we're going to have a lot of people in here. And they were not kidding. I think I had 25 people in that room, not including the people there during my delivery that I had invited. We had an entire team of doctors for me, and we also had an entire peds team and like neonatal team for Annie, just in case something happened, since they were kind of losing her heart rate a bit. But because I was 10 centimeters dilated, they decided to go ahead and push instead of doing a C-section, because it would take, some time to get a C-section prepped and stuff. So I'm really weirdly like zen at this point. I'm kind of like, okay, so that's not great. But we're gonna push as hard as we can and get her out as fast as we can. You could definitely feel the urgency based on how many people were in the room. So I got my OB that I had been seeing to deliver me, and sometimes at this hospital that's not always the case, and I knew that going in, and I wasn't super worried about it. because I trusted the team that was there. I think I'm pushing for 2 minutes, not even. I'm contracting literally every 30 seconds. I am not getting a break from these contractions. It is crazy and it is painful. But honestly, I don't even remember feeling them while I was pushing, because there's just so much going on. So I had my husband there and my 3 sisters-in-law, all 3 of which have had babies of their own. And it was really important to me that I be surrounded by other women who had been through this and could, help and support me through it. I just wanted this, really empowering feminist experience. And I was really glad that they were able to be there. So about 2 minutes goes by, and my doctor is like, all right, she needs out now, right now. And so they call for forceps. So forceps increase your risk of hemorrhage, tears. They're not great. But of course I consented to forceps because I understood the urgency of the situation. I mean, I am the type of person that does her research. And so I knew they weren't going to call for forceps if it weren't the situation where we really needed her out in that moment. And so it's still only been 2 or 3 minutes. It hasn't been long. At this point, things are pretty serious. You can feel the tension in the room. And I push a couple times. And again, a comment is made she needs out right now. This is getting bad. Yeah. The gravity of the situation was not lost on me. And so instead of waiting for contractions, because it's easier to deliver if you deliver during a contraction, apparently that is what I gleaned from the situation, but they were like, okay, you're not contracting, but you need to push anyway. And so I pushed so hard. It was just sheer force of will. I knew she needed out, and I was like, okay, she's getting out now. Made the decision, it's happening. And not that delivery is necessarily just you can decide they're coming out, but I swear I decided she was coming out. And so with the help of forceps, I delivered her not during a contraction in about 2.5, 3 minutes. And they lay her on my chest. She's a little purple. She's not breathing. I didn't get to hear her cry. I didn't get to have that golden hour with her. Corey didn't get to cut the cord like we had anticipated on. And instead, my OB cut the cord as quick as he could and passed her off to the pediatrics team and the team from the NICU. And I don't know, 10, 15 minutes go by. I have no concept of time at this point. I'm lying on the table. I'm kind of shaking a bit, which is apparently fairly normal. And I'm just so tired and shocked and confused and, I don't even know what I was feeling. I was feeling so much and nothing at all, if that makes sense. That doesn't make sense, but that's still what I was experiencing. And there were so many people surrounding her in the little NICU crash cart and stuff that they have there. I couldn't see what was going on at all. At one point, one of the doctors is like, if you are not actively working on her right now, get out of the room. And people have to be pushed out of that little adjacent room that she was in. It was so crowded. And I was kind of like, okay, that sounds serious. I still haven't heard her cry at this point. I have no idea what's going on. I'm not even asking questions. I'm just completely laying there, paralyzed in shock. And meanwhile, I have 4 tears. None of them were particularly serious tears, but there were a lot of tears, a lot of small tears. And that's pretty normal for a forceps delivery. The nurse on my left, he was holding my hand, I think, and he was like, you delivered her face up in 2.5 minutes. That's incredible, because apparently delivering a baby face up, they're supposed to be face down, is not only really painful and increases, back labor, but it's also physically harder to push them out. So I had that going, which sucked. And I didn't even know what that meant at the time. I was just kind of like, oh, okay, I guess I wasn't supposed to deliver her face up. Also, did we not know that she was face up? Like, did we miss that? Yeah. What was that? So, I had previously told Corey to follow the baby wherever she went, if they took her out of the room. So, I have Corey over in the little adjacent room with her, standing to the side, watching what happened. I can't even imagine what was going through his mind in that moment. And I'm so freaking grateful that his sisters were there with us, because they were so calm and collected, and one of them was always by my side holding my hand while Corey was watching Annie and making sure she was okay. It's probably like 2 hours they're stitching me up, because they finish stitching me up and they're like, okay, we're going to check to make sure there aren't any other tears. And they start feeling around and I hemorrhage. It wasn't a great hemorrhage, because I needed a blood transfusion with like 2 bags, and I lost like 1 liter or 2 of blood. It was a lot of blood, and I started getting dizzy, and like blood is just, it's so gory. It just squirts. Like, when you hemorrhage, it is just like squirting out. It's awful. I won't get too in depth about that, because that's probably traumatic enough, but it was not great. And so I'm being stitched up for 2 hours. They can't get the blood to stop oozing, and so they like pack you essentially with gauze. And so they start antibiotics, and because I have a mild penicillin allergy that we had noted when I was a kid, they used something in the penicillin family, but not like the same, like Augmentin, which is what I had a reaction to. So my eyes start swelling up, and they need to give me IV Benadryl, and it's a mess. And they're not totally sure whether it was a transfusion reaction or a reaction to the antibiotics, but it was probably the antibiotics, given my history of allergies. So Corey finally comes in. He's been in the NICU with one or two of his sisters and Annie for the past 2 hours, and so I'm still, like, I am so pale. I looked awful. I looked so bad. They had brought over Annie to meet me once they got her stabilized in the room, but she was intubated, so they said, we're breathing for her. And I got to meet her very briefly, and I was so in shock and scared and confused, and all I said was, wow, she's so little. Oh my gosh. Like, I just kept repeating that over and over again, because I didn't know what else to say. Like, what do you say in that moment? Like, your daughter's not breathing on her own. You don't know the extent or the severity of the situation. Like, how are you supposed to know how to respond to that? So Corey comes back in 2 hours later, and he's like ghost white. He's just experienced his wife have a hemorrhage and his baby almost die in the span of like 5 minutes. Yeah, I know, it was scary. It was real scary, wasn't it? Yeah. He says she's stable, but they have some concerns. They think she's having seizures and might have some damage to her brain from the lack of oxygen or blood flow at birth. Obviously not what you want to hear. No, it wasn't what we want to hear. Once they make sure that I'm stable and I'm not going to continue bleeding and need to go to the OR to fix my shoulder, the slobber, to fix the hemorrhage, they eventually transfer me to the postpartum wing. And Annie would be in the NICU for 14 days at this point. I got out after 2 days. I probably should have stayed because I physically couldn't walk because I was in so much pain, and my tailbone had rebroken during labor because it had previously broken and was in the wrong position and something like that. I don't know. I was in so much pain. Standing up was awful. I would need a wheelchair for a couple days afterwards. So anytime we visited the NICU, I was pretty much in a wheelchair for the next week. So she was diagnosed with moderate HIE at birth. Hypoxic ischemic encephalopathy, which is not great. We had a family friend who's a neonatologist tell us, don't Google it. And of course, at like 4 a.m. while I'm still in the hospital, I Google it and am like sobbing by the time my doctor comes in to check on me. It was so bad. Because all you're seeing is like seizures, reduced brain activity, death, severe disability, cerebral palsy, and hang on. The treatment for HIE at this point is therapeutic hypothermia. So they cool their body temperature down to, I think it's 92 degrees or something like that. Rigby, don't eat trash. Everything is chaos right now, obviously. Rigby, don't eat the box. So for 3 days, Annie has to be cooled on this cooling mat that is kept at her at a very specific temperature. She has all of these electrodes on her because she's doing an EEG to check her brain activity for any seizures. And at the end of those 3 days of therapeutic hypothermia, she will be getting an MRI to check the severity of the trauma, the injury to her brain. So we're just in limbo for these 3 days. We don't know what the outcome is going to be. Because they're like kind of sedated a little bit and their metabolism slows down and everything. So like we're not seeing any of her personality. She's asleep most of the time. And she has so many wires on her that you are kind of afraid to touch her. It's not a great situation at all. And the worst part is that I'm not even allowed to hold her. Corey's not allowed to hold her. No one is allowed to hold her. The most care we can be involved in is changing her diaper, which I still took up because I was so grateful that at least we could do that. What are you eating? The 3 days pass. I'm trying to pump desperately to get her breast milk, but when you have a hemorrhage that bad and need a blood transfusion, it takes longer for your milk to come in. And the milk that does come in is pretty scarce. You're not eating that. You're not eating that. No. Stop it. They give her donor milk because I'm not producing enough. And I'm so grateful that we had that option to do that. 2 weeks go by and my milk still hasn't really come in. But we'll get to that later. 3 days pass. And they take her off of the hypothermia mat and start rewarming her, which is a process that takes like 6 to 12 hours because they want to, bring her back up to temperature slowly so her body can react as best as possible. Rigby, what are you eating? And the day comes for the MRI. She hasn't had any seizures since their original concern for seizures, and the doctors become increasingly convinced that maybe it was not a seizure at all, because what they were seeing was just kind of repetitive arm movements, and sometimes infants can do that anyway, but they wanted to be on the cautious side, And her MRI comes back great, like so great. There's one little spot that could mean she might have an ocular or like a spatial field defect, but more likely than not it'll be nothing. So her MRI mostly comes back great, and what's interesting is that the one spot they found wasn't even really like usually correlated with a typical HIE injury, and rather it can be associated with like low blood sugar and stuff. So really, we get the best news possible. Of course, a good MRI can't predict whether or not she's going to have delays in the future. So it's still very much a wait and see kind of situation. So they start feeding her bottles now that she can be removed from the mat and we can hold her. Finally. Oh, it was so hard to not hold her. But getting to hold her for the first time was just incredible and wonderful and one of the best moments of my life. But my gosh, it was so hard to have to wait days to be able to hold your newborn. Like, I feel like my birth experience deprived me of a lot of usual things for birth, and not getting to hold her was one of those. And instead you just watched her in this little incubator. And a lot of you who had like preterm babies probably understand that too, or any other kind of birth trauma. But those 2 weeks were hard. The hospital was 30 minutes from our house, and so we would drive 30 minutes there and 30 minutes back every day, every single day. And my husband was dealing with PTSD from everything, understandably. I won't really talk about his journey and experience just because I want to respect his privacy, and he's a little bit more reserved about sharing things on the internet than I obviously am. But long story short, it was really hard on him. But we were able to have my sister-in-law, one of them, and my dad visit her every day as well. They only allowed 2 visitors, and those visitors couldn't change. They had to be the same people for her entire stay. So I'm really grateful that the moments we couldn't be there, they were often there. So she was always with someone. And the NICU staff, incredible. Like, they did such a great job. I think she got really stellar care. And the fact that we were at a hospital with a NICU, I think, made all the difference when I delivered. I will never give birth again. Or I will never give birth at a hospital without a NICU. Like, a very high level of standard NICU, ever. And it was so great because this NICU also had an affiliation with the nearby children's hospital that is very, like, highly renowned for care. So she had teams at UC and she had teams at Cincinnati Children's, and they were both amazing. And we got to talk to doctors and nurses and so many people every day. And they made a really hard time bearable as you could. So for the next week and a half, she's just working on feeding. So they're weaning her off the feeding tube and starting to introduce a bottle of formula, because at this point my milk has still not come in. At least I was only getting 1 to 2 ounces a day. So she was mostly formula fed. And that was really frustrating because that was also not the journey that I had wanted. But she started feeding really, really well. And she weaned off of all oxygen. Our first family photo was in the NICU the day they de-intubated her. I don't know the real technical term for that, but the day they removed the tube and she started breathing on her own. Eventually, we were able to take her home with the knowledge that she may have delays. She may have cerebral palsy. We just won't know. So thankfully she has a lot of NICU follow-ups, and if you could keep us in your thoughts on the 22nd, February 22nd, she has her 3-month NICU follow-up, which includes a general movement assessment, which will help give us a clearer idea as to how she's progressing. And tomorrow we meet with early intervention for the first time to start intake process for an evaluation for that. She has so far met all of her milestones. She's still young. She's only just almost 3 months. So there's a lot more milestones to go, but she's been feisty and so strong. Like when she grabs your hand, it is very, very tight-fisted. She pulled out all of her IVs. She pulled off electrodes. She's been feisty from day one, and I love that for her. And all of her doctors kept saying, like, you know, this is a really good sign. Like, it's great that she's this feisty. And so in the hard moments, I really held on to that knowledge, and I'm so glad that they just kept saying, like, she's doing great. So obviously, we still have a long road with her for the next 2 years while she's being monitored by the NICU follow-up team. And I am watching every single milestone like a hawk. Like, if she is a day behind a milestone, I panic a little bit. And it's kind of hard to not, given everything. I feel so lucky that her situation, although she was diagnosed moderate HIE because they thought she was having seizures, even with that, she is presenting so mildly, and her MRI was so mild as well, that she very well might have a completely normal and healthy life. And, you know, like, I work with patients with disabilities. I am ready and willing and emotionally prepared to handle it if something comes up, if she does have CP. But obviously, like, you want life to be as easy as it can for your child, you know? And it's just, no one ever plans on their kid having a disability. And so everyone kind of goes through that mourning process in their own way. But we're all really optimistic. She's doing great. She's beautiful. And she's so strong and stubborn and silly. And I just love her so much, even though she looks like a mini-me of my husband and barely looks like me. I think she's starting to look like me a little bit more. Rigby, what are you doing? Yeah, that's her birth story. We never were able to get the breastfeeding situation sorted. So she's formula fed, and that's a disappointment, but formula is great. There's nothing wrong with formula, and she is growing like a weed on it. She's still small, as a lot of you guys might remember from a ways back in the Discord. I had posted, you know, they had some concerns for, like, intrauterine growth restriction for her because she was really tiny. But she did catch up. So she was born at 6 pounds 4 ounces and 19 inches. So that's our girl. She's doing great. She's in the 10th percentile, so she's tiny. But that's our story. Sorry, it's been a little chaotic. Having all of your support and kindness and understanding in the Discord as I've been posting updates about her, and all of your collective knowledge about child rearing and everything has just been so amazing. So I love you all, and I'm so grateful that you got to be here through all of this to help me and support me in every way that you can. Like, I've felt so loved by the community throughout this entire process. So thank you all so much for sticking through this little story time with me. I hope I didn't traumatize you too much. Birth is still beautiful and wonderful and amazing, even if it doesn't go the way that you planned it to go. I don't know if I'll do it again. I know. I don't know if I'll do it again, but I might.